Hello, everyone. Good afternoon. We still have folks joining the webinar, so I'll speak slowly to give folks time, but we're going to get started because we have a lot of information to cover today, and we want to make sure we get to it all. Thank you all for joining today's webinar. Before we begin, I'd like to cover a couple of technical issues. So first, if you come across any problems, technical problems with the webinar, please chat to the host. And you can find the chat box on the right side of your screen. And if it doesn't appear, if you don't see it, just click the dialog bubble on the top right toolbar, and it will pop up. During the webinar today, you can chat your comments or questions to the panelists as we go through the presentation. We're also going to have a couple of opportunities for poll questions and opportunities for people to chat in questions later on, of course. But if you have any during the course, just chat them in and we'll keep them, we'll log them and keep them available and answer them all at the end. Thanks again for joining us, and let's get started. So on behalf of the Community Technical Assistance Center of New York, it is my pleasure to welcome you to today's informational webinar for the Resilient Informed Service Environments Learning Community. So we're going to provide you information today about participating in the learning community. We're very excited about this project because we've been doing a lot of work here at the Community Technical Assistance Center for some time now on trauma-informed care. And as we've been doing that work and sort of providing information and knowledge and building people's awareness of trauma-informed care, we've also been realizing that we focus, or we need to focus not only on trauma, but on what we call the opposite or the other side of the coin from trauma, which is a thorough understanding of resilience and what agencies and organizations can do to help people who they serve build resilience. And so this learning community is going to be focused on that side of it, understanding how and what we can do to build resilience in the people we serve across service environments and across programs and organizations. So with that said, I'd like to introduce myself very quickly. My name is Jim Rodriguez, and I'll be the coordinator for the learning community. I have been here at the McSilver Institute for 4 years now. I am a licensed clinical social worker and licensed psychologist in New York State, and I have over 25 years of experience in training and research and clinical practice, and primarily in the area of trauma, in mental health in general, and therapy, and providing therapy. So I've been doing a lot of work for many years now, and this learning community and the work in trauma-informed care that we do here at CTAC is really near and dear to my heart. So one of the things, so I also want to let you know that Anthony Salerno, Dr. Anthony Salerno, who will also be involved in this learning community, unfortunately has fallen ill to whatever is out there, so he won't be joining us today, but we will be talking and letting you all know a little bit about him later on as a member of the learning community and a leader in the learning community. And I'd like to turn it over to the other members of the support team for this learning community. Kara.
Thanks, Jim. Hi, everyone. My name is Kara Dina Sale, and I'm a social worker. And similar to Jim, I've been in the field for many years, over 20 years. Began my work in a residential treatment center with youth who've been in and out of foster care. And I say that experience really gave me a crash course in systemic racism, self-care, and also trauma. And so since then, those have been my interests in some capacity ever since, and in particular around trauma-informed care and resilience-informed care. We at the Institute and through CTAC have been having many conversations about how can we really further this work with our providers in New York State. So really excited to be here today and to continue to talk to you about our work and what we have created for you to participate in, and really look forward to our time together. Thank you.
Jason?
Hi, everyone. Thanks, Jim. Hi, everyone. My name is Jason Jones. I am also a licensed social worker, and I've been with the McSilver Institute and CTAC for about 3 years now. And I oversee our learning management system, so I'm really excited that you're able to join our webinar and hope that you can take part in our project.
Yes, hi, this is Diana. I'm a social worker here at the CID department at the Institute, also at McSilver for about 3 years, and I'm very excited to be here with you all today.
And great. Hold on a second. So welcome. I want to say a few words about the CTAC. So for those of you who may not know, the Community Technical Assistance Center of New York is a training and consultation and educational resource center serving behavioral health agencies and health agencies and across New York State. And we provide training and technical assistance in a variety of areas and quality improvement strategies in a variety of areas, including clinical practice and clinical skills, evidence-based practices, and other cutting-edge issues within behavioral health. But we also provide training on organizational management and helping organizations improve their fiscal capabilities and dealing with managed care. So we cover a lot of ground. We're housed at the McSilver Institute for Poverty Policy and Research, and that's important because our work in the Institute is dedicated towards generating knowledge and disseminating knowledge that addresses the root causes and consequences of poverty. And so when we talk about trauma-informed care, one of those connections to poverty is understanding that in the trauma field, of course, that exposure to adversity, severe adversity, has long-term impacts. And so we see a very strong connection between our trauma-informed care work and addressing some of the root causes of poverty. And in our work through the CTAC, we have funding from the state through the New York State Office of Mental Health and the Office of Substance Abuse Services, as well as the Department of Health. And we provide a number of free programs to providers. And so one of the things that we want to be clear is because we get our funding from the state, that's why we're able to provide programs like this free of cost to you all as providers. And then our agenda for today, okay, here we go. Our agenda for today is to talk a little bit about trauma-informed care for those who may not have information about it, and of course make the connection between trauma-informed care and resilience. And we're going to talk a little bit about why this learning community is important, and then we're going to give you information about, we're going to talk about the evaluation process, so we're going to be also evaluating this learning community, and then we're going to give you very specific nuts and bolts information about how to join RISE and what the expectations are for participation in RISE, and then we'll end with questions and answers. And so I'd like to turn it over to Kara to walk us through a poll question.
Yeah, so, you know, as Jim mentioned, we are so excited to be with you today, and we just want to start by understanding who's on the line with us. So there's a poll that popped up on your right. So we want to know who's with us today. What kind of services do you provide? Do you provide A, mental health services for families, B, mental health services for adults, C, substance abuse services, D, school-based services, E, inpatient services, F, residential services, or G, peer services. So please chat in with us, A, B, C, D, E, F, G, lots of options, so we get a sense of who's on the line with us. So the poll will close in about a minute, and then the responses will pop up, and we'll go through them. Okay. Let's see, and as a reminder, if you have any questions for us throughout our time together, please feel free to chat in, and we'll be happy to answer those as we have discussion. Okay, so it looks like most of you are providing mental health services for families, or mental health services for adults, or substance abuse services. So thank you, and a few of you are providing peer services. Thank you so much. And it looks like a few of you checked in that you actually do 3 of these or more. So thank you. So some of you do provide multiple services to individuals. Thank you so much. It's really helpful for us to see who's interested in participating in the services that you provide, because we are going to be thinking about the services you provide during our time together. So I'm going to talk a little bit about trauma-informed care and what that means. So I'm sure all of you by now have heard about trauma-informed care because it is a movement. And I think it's a really important movement. I've not, over the past few years, I've become more and more excited to be a part of this field. Actually, I'm in school now to get my doctorate because of this movement and the amazing work that's being done. Because I don't know if you're able to relate, but, for years I had this sort of a sense of frustration in my work and my clinical work around feeling like I was just handing out diagnoses and handing out treatments and not knowing for sure if we got to the root of the issues, right? And so this trauma-informed care movement really urges us to think about that and think about what has happened to someone as opposed to what's wrong with them. Dr. Nadine Burke-Harris, whom really is also leading this away. She's a pediatrician in California, and she has an amazing TED Talk that we have the link at the end of our webinar for you. And she talks about a well of water. And she said, she comes from the public health and medical part of the world. And she said, if kids are coming to see me because they have experienced some kind of stomach issues from drinking water out of the well, if 9 out of 10 of them have that, then we just write the prescription for the stomach issues. But now we're being urged to go to that well. And I think that's a really important message for all of us to think about how can we start to change the well? And so that's why we really have, as I mentioned earlier, we've been talking about this for a long time in our work and seeing how we can really start to really move the dial on the work, on the really important work that you all are doing. Trauma-informed care really refers to how we think about and respond to those who have experienced or may be at risk for experiencing trauma. It's important because of the pervasiveness of trauma, and it helps us shift our perspective from what's wrong with you to what's happened to you, as I mentioned earlier. Hopper, who's a researcher and a mover in the field as well, and others have said, trauma-informed care is a strengths-based framework that is grounded in the understanding of and the responsiveness to the impact of trauma that emphasizes the physical, psychological, and emotional safety for both survivors and providers. And it creates opportunities for survivors to rebuild a sense of control and empowerment. And I think that's really important. So you are going to hear about these principles around trauma-informed care, and safety and empowerment are some of those. Trauma-informed care and resilience-informed care, as we're thinking about it in our work, is relevant in all of our systems, and especially in our service delivery systems, including schools and early childhood services, juvenile justice, and health and behavioral health, and substance abuse services. So these two studies, adverse childhood experiences and ACEs-related research, they really demonstrated the serious health and mental health consequences of trauma experiences. So I just want to talk for a minute about the ACE study. If you haven't heard of it and you don't know about it, just really quickly, it was a study conducted by Dr. Vince Folletti and Dr. Bob Anda, and Dr. Folletti was from Kaiser Permanente and Bob Anda from the CDC, and it's one of the largest studies done on the subject of trauma, and with over 17,000 people participating. And it really is one of the leading studies from that started all of this work. And Dr. Folletti had been working with severely obese people, and time again, he would help them to lose weight, and they would eventually gain back the weight. And he said to himself, kind of going back to that well, like, what is happening here? What am I missing? What's in that water they're drinking? And so he found out, through a series of questions he began to ask, that a lot of the people that were regaining weight had experienced some kind of sexual abuse. And so this began to really transform this work. So they went to look at the adverse childhood experiences or trauma over the lifespan. There were 10 types of childhood trauma measured in the ACE study, which is the Adverse Childhood Experiences Study. 5 of them were personal and 5 were related to the family system. So it turns out if we experience any of these adversities, then we are more likely to have health problems, including asthma, mental health problems or challenges, including depression or suicidality, substance use and abuse, or even we may be a victim or survivor of domestic violence, intimate partner violence, or even poverty. We may also experience poor academic achievement, and it may even lead to early death, is what our findings are telling us. The prevalence, as we know, adverse childhood experiences are very prevalent, and the study found that 64% of people experience at least one ACE, 20% reported 3 or more, and 12% reported 4 or more. And so we also know that this study was done with a population who were receiving private insurance, and we know that through other studies, such as in Philadelphia, that these statistics are even higher than we think. I'm going to turn it over to Jim to talk about a trauma-informed organization.
Thank you. So when we talk about trauma-informed organizations, as Kara said, that a study was really a game changer in many ways, sort of ushering the beginning of the trauma-informed care movement because of the high prevalence. And you know, the study, in many ways, we can all sort of understand the idea that being exposed to trauma and adversity will lead to bad outcomes. But what that study did was really document how pervasive it is and the wide variety of outcomes that it can impact. And for service providers, though, so even though those numbers kind of show only, and that's a large number, but 20% of folks having more 2 or more ACEs and 10 or 16% more having 4 or more ACEs. What that really means for service providers, people who are providing services in mental health and in homeless services and in social services and in the juvenile justice system, even though in the general population those percentages are low, those percentages are huge in our service settings. And so there's an understanding through ACEs and in the development of trauma-informed care that in our service programs, again, social service programs, mental health and behavioral health programs, and in the health system at large, oftentimes when people come in for help, it is because they have been exposed to trauma and adversity. And so it's led to helping people, helping organizations change and realize that there is this prevalence of trauma, that trauma is out there, and it's prevalent in society in general, but it's also even more prevalent within the programs that serve them. The other thing that's really critical and important to understand in a trauma-informed organization is this recognition of the impact of trauma on not only on patients and people who receive services, but also on the providers, the caretakers. So one of the things that we talk about often in trauma-informed care is providing support to the caretakers, to the providers, to people who are working with people who've been traumatized, because oftentimes there's some secondary or vicarious trauma. And then we respond by putting what we know about trauma into practice, providing information to folks about if you understand the prevalence of trauma and understand that many people who come to your services have been exposed to trauma or adversity, there are practices, there are approaches that you can use that are trauma-informed that can be used throughout your service settings to provide help. All of this is to try to avoid re-traumatization. And that's a big issue in the trauma-informed care world, is understanding that oftentimes if we don't understand how prevalent trauma is, we can inadvertently re-traumatize folks through our policies and practices and procedures or lack of understanding. And then one other R that we add that's not in here is actually remembering resilience, and that's the main reason why we're having this this learning community, is to understand the importance of resilience as well, and what service providers can do to build resilience in people who receive services. And I'm just going to go through these very quickly. We go into a lot more detail in the training, but these are 6 principles that were laid out by the Substance Abuse and Mental Health Services Administration and an entity of the federal government that's been doing work in trauma-informed care for many years, and they've laid out these 7 principles. I'm not going to go into all of them in depth, but the first one is a critically important one. It speaks to the critical need to create safe environments for people who have been exposed to trauma and adversity. The most important thing when you have been exposed to trauma and adversity is a feeling of a lack of safety and trust in others. And so it's critically important to have safe environments that people feel like they can come to for help. Principles 2, 3, and 4, trustworthiness and transparency, peer support and mutual self-help, collaboration and mutuality. There's specific practices and policies that we can talk about within those, but more importantly, those three principles speak to the importance of relationships. So what is critically important, what trauma and exposure to adversity does oftentimes is affect people's interpersonal relationships, their ability to form interpersonal relationships, and their ability to engage in trusting relationships with others. So helping people develop relationships is really critically important in a trauma-informed care world. And so those three principles speak to that. And then Principle 5 speaks to helping people who have experienced trauma and adversity, help them regain a sense of control. So one of the other things that trauma and adversity does is strip people of their sense of control over their own lives. They're often filled with intrusive thoughts and feel like they can't control those thoughts, and they oftentimes feel like they can't control their emotions. So providing them with an opportunity to gain empowerment and control over their lives is critically important. And the last one is really critical because, and this one was really a new principle that SAMHSA added not too long ago, the notion of cultural, historical, and gender issues. What we're talking about there in many ways is anti-oppressive practice. Understanding the importance of historical trauma, of cultural competence and the importance of cultural competence in the work that we do, and understanding gender issues and power and what role that plays for people who've been exposed, and one of the reasons why people have been exposed to trauma and adversity, but also helping organizations understand and attempting to try to change the narrative around power and control within their agencies. And then, so the bottom line is, these are some of the things that a trauma and resilience-informed organizations do: increases safety for all, improves the social environment, provides care to the caregivers or the providers, increases the quality of services by doing all this, reduces negative encounters and events, again, avoiding re-traumatization, and creates a community of hope. Oftentimes, when people understand that their problems might emanate from trauma and that there are things they can do to recover, that gives people hope and a sense of having a better future. And then lastly, increases success and satisfaction at work, again, both for the people who receive services as well as those who provide services. So why focus on resilience? Very quickly, trauma, at the very core, trauma is an external event. Right? So trauma, we know trauma, and as Kara was talking earlier about Nadine Burke-Harris, her idea of going to the well, finding out what the cause of people's problems in the here and now are. When we go to that well, we're going to find out how trauma has impacted some, but we know it is an external event that is related to people's problems. So if an external event can create the problems that people face in their lives or contribute to the problems that people face in their lives, an external event can help them to recover and overcome the exposure to trauma and adversity. We focus on resilience because we believe that resilience, if you have a thorough understanding of resilience, will help you understand your role as service providers in helping people overcome and recover from exposure to adversity. So very quickly, and our definition of resilience, we talk about it as a dynamic process reflecting positive adjustment to significant risk or adversity. As we said earlier, this is the other side of the coin from trauma. It requires a focus on resilience, a bifocal lens, being able to see things from a trauma-informed lens as well as what we can do to build resilience. And if we understand resilience well and what builds resilience, that should guide our policies and practices. And one of the things that we want to be clear is that service providers can, in fact, help people build resilience as an outcome. We believe very strongly that resilience isn't something that just falls in the individual, that as a trait that individuals have, but it is something that can be promoted by supports and systems outside of the individual. And so this is And this is just a graphic representation of that. We know, for example, that people do in fact have individual strengths. They do have intelligence. They do have temperament. They do have problem-solving skills. And if they don't, those things can be taught. So people do have individual strengths. But also what is important, critically important in terms of building resilience is the role of significant others. So one of the things that we know about resilience is that oftentimes it can be promoted by parents and caregivers, as well as peers and mentors. People, significant others in the lives of individuals. One of the things that we know helps people overcome trauma and adversity is the critical importance of significant others in their lives. And so in that vein, it is important to also provide support. So many times, if you're a program that's providing, for example, support to parents in terms of helping them with discipline strategies or how to monitor their children or how to deal with their children's behavior, that is resilience building, because what you're doing is strengthening the ability of significant others in the lives of the child to promote resilience. And then lastly, there's systems and culture, and it's important to understand, and much of the work that we do is in helping programs and helping service providers become better at delivering services, providing greater access and quality services to folks. That can help build resilience. We also know with regards to culture, though, that things like religion and connection to people's cultural and racial and ethnic backgrounds and histories, and developing a sense of identity and connection to people's culture can be incredibly important and help build resilience. So when we think about resilience, we think that it falls at the intersection of these three things: individual strengths, the importance, the protective ability of significant others, as well as the resources that are available through systems and culture.
And I think to summarize what we're really saying is that relationships matter. So as Jim mentioned, relationships help not only with coping with adversity, but also healing from trauma experiences. And building resilience also happens in relationships. So I just want to draw your attention to the last part of this quote from Fisher and Prescott in 2010 that we're looking at what really helps. And this quote, I think, is really, really powerful. But the ending says, because trauma very often happens in the context of relationships, it is within relationships that healing must necessarily commence. And I think what we're really saying is that if trauma-informed care has asked us to rethink about what's wrong with you to what's happened to you, we think resilience-informed care is really to ask the question, what is most helpful for you? And so on that note, we really want to ask you, in what ways has your organization currently engaged in resilience-building practices or policies? So if you could chat in with us, we'd love to hear what you're currently doing, because it's also a starting place for you, if you're going to participate with us, that we could continue to build upon that great work. So in what ways is your organization currently engaged in resilience-building practices or policies? So the chat box to your right, so please feel free to chat in anything that you're currently doing. In the past, this is our second webinar. I can share, no one's chatted in, so I can just share a few that we heard in the past. And one of those was around offering peer services, really offering resilience building groups. So skill groups was something that we heard. Is there anything that you're currently doing? And I think thinking about policies is really important as well. Okay.
Well, we will move on.
Yeah. Well, we have one. Oh, great. Now they're coming in. Exploring and training staff and the community in mindfulness skills. Wonderful. Mindfulness groups, town hall forums. Yeah. Fantastic.
Yeah, and if I can just be very clear, so mindfulness, why mindfulness would be critically important in terms of trauma-informed care and building resilience is very simply that one of the things that folks who've been exposed to trauma and adversity have a difficult time with is being able to regulate their own emotions. Again, going back to what I said earlier about the loss of control, part of it is being able to regulate their own emotions. As an approach to helping people regain some control over their emotions and be able to control their thoughts as well, mindfulness is a great approach. So very good, and I actually absolutely see that. And then also town hall forums, again, helping people to connect to others is really important. So very clearly connections here. There's a lot that falls under resilience, sometimes we're not even aware of. Recovery and resilience group psychotherapy. So yes, so someone is sort of talking specifically, Wanda Rodriguez, no relation, is talking about recovery and resilience group psychotherapy. One of the points that I want to make, and again, for those of you who may be new to this area, there have been many treatment approaches developed to address trauma. When we talk about trauma-informed care and resilience, we're not necessarily talking about therapeutic approaches. There have been many that have been developed out there, and we can certainly talk about those and provide people with information and resources on how to get trained in those as specific trauma treatments. But when we talk about trauma-informed care, it's more of a holistic organizational approach to changing the way organizations do business.
Wow, and there's so many that are coming in. Art therapy, fantastic. They can focus on other means to express people's experiences and hear their voices. Tiffany said that we operate from a strengths-based perspective and allow our families to have their own voice and choice. Case planning. You all are doing so many amazing things. My organization has, I lost that one. My organization has educated some of our social workers on trauma-informed care and integrating EMDR and mindfulness into practice. Rose programs. There's so many great things. Thank you so much for chatting in with us.
So we're gonna move on, but those are great. And for those of you who may not be aware of those different approaches that people are talking about, then trauma-informed care and our trainings definitely can talk a little bit about those. But we're gonna move on because we're also gonna talk about what participation in the learning community means. And for those who are already doing that work, there is room for you to build more, and that's one of the things that we want to sort of stress. So with regards to this learning community, a learning community is, in fact, a way to share and exchange information and resources for folks who are already using some of these strategies, but also to build. I'm going to turn it over to Kara because Kara also has a lot of history and experience running learning communities for us. So, Kara, talk about a learning community.
Thanks, Jen. Thank you. Yeah, I really want to talk briefly about what a learning community is, why it's important, and then the rest of the team will go into the specifics. But just really short, really quickly, a learning community is really an opportunity for programs or organizations to get together to improve services related to a specific area of quality. And in this case, we're looking and talking about trauma and resilience-informed care. It's a real opportunity for people, programs, or organizations to learn from each other by sharing their experiences with each other. And a learning community is also a method for learning that is guided by a resource team to support all members and participants. And so we are your resource team. We are only half of your resource team, so we're going to show you everyone in another slide in a little bit. So why is a learning community important? Well, for a number of reasons, right? So to begin with, it really ensures that common and unique concerns, challenges, and needs are addressed. It includes social networking opportunities between and within organizations that really include stimulating experiences and conversations and shared learning encounters. It really builds on the collective wisdom, knowledge, and real-world experiences of participants. So you all, as you just stated in your chats, you're already doing some amazing things. And so really building on your collective knowledge and your wisdom and sharing that with others and learning from others is really why a learning community is important. And finally, it's important because it's also an efficient and effective method to help support practice improvement and resilience and trauma-informed care. And when I say efficient, I'm serious, because if we go to the next slide, the aims of our learning community, just want to talk a minute about that. So it's only a 4-month partnership. So you're only with us for 4 months. We hope to, we can continue to think about afterwards as we near the end, but it's really a 4-month commitment with organizations across New York State who have an interest in exploring trauma and resilience-informed care. And what we aim to do is that we're going to work together to really build a common understanding of trauma-informed care and resilience-informed care with providers, supervisors, administrators, or anyone that wants to join us to establish an ongoing partnership to really identify the most useful components of trauma and resilience-informed care for you. This means we're going to provide training and support to implement resilience-informed strategies in your organizations, and we're going to assist organizations or providers in conducting an organizational self-assessment of practices and policies consistent with trauma and resilience-informed care. And then we're going to assist your organization in the process of organizational change management is what we call it, which really includes taking actionable steps by identifying an improvement goal and a plan. And we will be, identifying a way to support you throughout that plan.
So what you get out of joining the learning community. So first, you'll get educational web-based trainings, trauma-informed care foundations, like Kara talked about, conducting an organizational self-assessment, but also some training on change management, how to take a project within your agency, identify a goal, and carry it through to make the changes necessary. You'll get corresponding consultation phone calls, and we'll be a little bit more specific about that in a minute. But what we want is folks to sort of understand a deeper understanding of trauma and resilience-informed care. One of the things I wanted to mention, too, just to give you a sense of what we mean at the organizational level, is we were recently consulting with an agency. We were doing trauma-informed care with their administrators and their service providers, but then they did an interesting thing. They asked us to also train their maintenance staff on trauma-informed care. It was a bit of a different kind of training, but they wanted their maintenance staff. This was a social service program providing homeless services, and they wanted some training and information that they wanted to pass on to their maintenance staff to understand trauma and understand what role they can play in helping people. Of course, not providing treatment, but what they can do in their daily interactions to help. So that's just an example of how a trauma-informed organization can develop, and a deeper understanding of organizational change management as well. As I said, in some cases, that alone may be worthwhile joining the learning community for, is understanding how to make change within your organization, and then conducting a thorough organizational self-assessment of your practices with feedback. And we'll talk about the OSA in a little while, but one of the things that you may do for those organizations who are already doing quite a bit, this could also be an opportunity for you to do some self-assessment and self-reflection on your practices. And then, as Kara said, access to our resources to help you along the process. Very specifically, what you're going to be asked to do, participating organizations will be asked to identify a core implementation team, a small team of people to serve as champions of this work from within your organization. And the core implementation team will be asked to attend 2 90-minute webinars, 2 one-hour consultation calls with the CTAC consultants, us, in the resource team, and then one final sort of interactive webinar where people will have an opportunity to share their processes and their outcomes within their organizations. You'll also be asked to complete an organizational self-assessment. It's really brief, but it can provide a lot of information. It should take less than 15 minutes to complete. And then in addition to that, we are evaluating the learning community itself, so we're going to ask you to complete some very simple measures pre and post on knowledge and awareness of trauma-informed care that should take less than 10 minutes to complete. I want to say a little bit about the core implementation team. So the core implementation team is a work group within each site that's focused on trauma and resilience. You'll be getting the training. And it's stakeholders from within the organization. It could include practitioners, of course, leaders and supervisors, as well as clients and program participants and peers. Really, you identify who the CIT would be and who the members would be. Each agency may involve anyone who's interested in this work, but we believe it should consist of a minimum of 3 individuals, a coordinator, plus at least 2 more people. So that's the minimum. We strongly recommend that agencies do have at least one supervisor or administrator who's either directly involved or at least knowledgeable and understands what's going on. So in order to make organizational change, it's important to have leadership involved in some way. So we think that you'll have to identify, or it's good to identify someone who will be overseeing this. And then we ask the CITs to engage in the activities that we've outlined. Now, I do want to mention a little bit about levels of participation, because we discussed on the last informational webinar, some people did express some concern about the requirements of participation and the burden of participating. We want to clarify that here. So first, for the CITs, if you're able to identify a CIT, there's two ways to participate. So let's say you're able to get 3 people or more together. We kind of identify sort of one group of folks who might be early adopters or innovators. What we mean by that is some of you, as you've already talked about, are agencies who might already be doing quite a bit in this area, but you may be looking to grow and do more. So for you all, if you're already doing some of this work and you've already gotten trained in trauma-informed care and already doing some practices and implementing some evidence-based practices out there and other practices that you've already innovated, you may be looking to grow and do more. So you can participate, as I say, as a CIT, but also sort of an early adopter innovator. And then there may be new adopters. You may be an organization that has been thinking about trauma-informed care, that's gotten trauma-informed care training. You kind of know ACEs and you understand the impact, but you kind of haven't started doing the work yet. This is an opportunity for you to become a new adopter, starting the process of making the changes that you'd like to make within your organization to truly implement trauma-informed and resilience-informed care. And then we want to offer a couple of other ways to participate. We realize that for some folks it may be a huge burden just putting together a team. You may just be thinking about getting the program started. So what we wanted to also offer is individual explorers. What we mean by that, this may be individual practitioners who are interested, possibly have never heard about trauma-informed care before, or maybe have heard about it but have never gotten training, or resilience, and you want to just get information and you want to increase your own knowledge and awareness. You can participate as an individual explorer, and we'll talk about how to do that when you complete the application process. And then champions. So again, it may be an individual or a smaller group of people. Maybe you're not able to get a CIT team going at the time, but you may want to try to do that. And your goal may be to sort of champion this work within your agency, and maybe the goal might be that by the end of the learning community, you actually have a CIT identified. So there are different ways to participate. We want to sort of be open and widen the tent a little bit in terms of participation in the learning community. I want to turn it over to Diana, who's going to talk a little bit about our trainings.
Yes, thank you, Jim. So yes, going back in terms of what you'll be getting once you join the learning community, this learning community does include 2 webinars that will focus on building awareness, knowledge, and competency. So we'll start with the basic concepts of trauma-informed care in order to build a foundational understanding. We will also cover vicarious trauma and secondary traumatic stress because, as Jim mentioned beforehand, the individuals who are actually doing this work do matter. We'll then highlight the importance of resilience in service organizations and provide strategies so organizations can expand from being a trauma-informed care service environment and move toward a resilience-informed service environment. We certainly do hope that the initial training on awareness building and basic concepts of trauma, secondary and vicarious trauma, and resilience will be a resource you can use to conduct more in-person training within your organizations. And this will be accomplished through a review of organizational change management and organizational self-assessments, which, as mentioned earlier, will be filled out by each of the participants in the learning community. In addition...
No, go ahead, I'm sorry, Dana.
No, go ahead.
So I just want to emphasize what Diana was saying and just sort of underscore that again, for those agencies who are already doing this work, part of the work that may be going on also is giving you some tools to disseminate it further within your agency. As an example that I gave earlier, you may be interested in doing some trainings with your other service staff, maintenance staff, security staff, things like that. Sorry,
Great, thanks,
Diana.
Jim. No, it's fine. So following up on the consultation calls are another component of the learning community in addition to the web-based trainings, and they'll provide the chance to develop and really implement the organizational change. And during these calls, we'll focus on identifying the key targets for change, developing a plan to implement the change, and offering feedback and monitoring the progress being made. And although technically not a consultation call, our last activity together as a learning community will be an interactive webinar. So we will cover sustainability because we do hope, as Jim mentioned again earlier, that we will continue with, you'll continue with your efforts to incorporate both trauma and resilience-informed care. This learning community and the creation of your CIT is a great start, but we want to provide you with some skills to keep this moving forward after the learning community has ended. So this webinar will be interactive in the sense that sites will also have the opportunity to share the work that you've all been doing and, again, to learn from each other.
And then a little bit about the organizational self-assessment. So we have a partner in the state, the Coordinated Children's Services Initiative, CCSI. Then they developed an organizational self-assessment tool. It has an online platform, so you can complete it online, and it covers a number of domains specific to trauma-informed care, including your screening, assessment, and treatment tools, your training and workforce development, engagement and involvement, physical environment, collaboration. All of these areas are sort of covered, as well as we focus on those first 5 because those are the areas that we think can best be changed within a learning community in the short period of time that we have, but some of those others under there are also covered in the organizational self-assessment. Things like how do you evaluate your trauma-informed care, your governance and leadership processes, progress monitoring, finance, and policy. So it covers quite a bit, and the way it works is you need at least 5 people within the agency to complete it, and once it's completed by at least 5 people, and you can do more, once it's completed by 5 people, it actually generates a kind of dashboard with the summary information in these key areas, so you'll have a sense of average scores within each of these domains, and then you'll actually get a report that not only tells you how you're doing in that particular domain, but some suggestions for how to get additional resources and some things that you can do to make changes within that domain. It's a very impressive system. Second. Jason.
Thanks, Jim. So for this virtual learning community, we'll actually be utilizing our learning management system, which is a web-based platform and your one-stop shop for everything that has to do with RISE. So through the learning management system, you'll be able to access the live webinars as well as the recordings, the consultation calls, any resources that we think are important to share with you, and most importantly, you'll have an opportunity to share resources with other organizations that are within the learning community.
And then our quality improvement method. So we believe very strongly that we want you to, in this idea of a core implementation team. So it does take teamwork. As I said, we've widened the tent, and if there are individuals who want to participate and begin there, that would be fine. But we do believe in the importance of a core implementation team that would guide this process. And then the first step is education, building knowledge and awareness within the organization, and then identifying the needs through this self-assessment process, choosing a goal, an improvement goal. We believe very, very clearly that, again, in 4 months, we don't expect wholesale changes within an organization, but that you identify some manageable and achievable goals that can be accomplished within a 4-month or can be started within a 4-month learning community. So identifying an improvement goal and then creating a plan of action, and then following the process of monitoring your plan through the Plan, Do, Study, Act process. We will be providing more specific information on how to do this within your organization in the second webinar that we'll be doing as part of the learning community. And then the evaluation.
Awesome. Thanks, Jim. So for the evaluation, we discussed this briefly, but we will ask for information regarding your knowledge around trauma-informed care, as well as your attitudes towards trauma-informed care. And both of those assessments will be less than 10 minutes, and they'll be collected before the learning community as well as after. We'll also ask each organization to complete an organizational self-assessment and really key in on areas of trauma-informed care that you'd like to work on for your specific organization. We'll, of course, ask for feedback along the way in terms of the overall process of learning community, and then we'll be asking for more detailed feedback through focus groups at selected sites. So in terms of the overall schedule, all applications for the learning community are due on March 1st, and we ask that you really focus on identifying the members of your core implementation team. On March 15th, we'll have the first webinar focusing on trauma-informed care and just kind of building awareness. On March 29th, we'll have the second webinar, which will focus on trauma-informed organizations, and this will be an opportunity to really delve into the organizational self-assessment. In April, we'll start our group consultation calls, which Jim mentioned will focus on action planning. So really thinking of some things that you could do within your organization to focus on trauma-informed care as well as resilience. And in May, we'll do individual consultation calls, which will focus on implementation. So now that you have your plan, what is it that you're going to do and how can you carry it out? And finally, in June, we're going to have a sustainability webinar, where we'll really focus on how do we continue your efforts with regards to trauma-informed care, and it'll be an opportunity for sites to present on their work and really learn from each other.
And very quickly, I want to talk a little bit about your resource team, but I also want to point out that Kara, thank you. Kara pointed out that CCSI actually is Coordinated Care Services, not Children's Services. Coordinated Care Services, Inc. I apologize for that. And actually, the other reason why I'm glad she reminded me about that is also because CCSI, as our partner, will also be part of our resource team as well. They're not listed here, you're not seen here, but they are going to be part of our resource team, and they've agreed to help us out for any agencies or organizations that need help, either in the organizational piece of it, but they also have training and technical assistance in a number of areas associated with trauma-informed care, so they do a lot of work in this area. And then actually, so your resource team here at the CTAC, these are them: Brianna Consalves, Caradina Sael, Jason Jones, who are on the call, Aya Port, who is going to be helping out with our learning management system. I'm Jim Rodriguez. Dr. Anthony Salerno has a great deal of experience doing learning communities, but also specifically work in this area of trauma-informed care and resilience building. Diana Arias and Tara Reddy is our intern. And so how to join RISE, Diana?
Thanks, Jim. Right, so we do hope that you join us for this learning community. So I wanted to give you a little bit of information in terms of how to join. As Jason mentioned, there is an application that is due, and that is due on Thursday, March 1st. And the application is available in several ways. So the application link is actually currently in your chat box. You can certainly click on it and bookmark it for later. Or you can also go to the website listed here. It would also be emailed to you, so please be on the lookout for an email from CTAC. And finally, you can email us at ctac.info@nyu.edu to request the application link to join us. Once you do receive the application link, there is some information that you will need to have handy as you're filling it out. So just as a quick reminder, you'll need the full contact information for your agency, the agency director, an organizational administrator or supervisor who will provide oversight and administrative support to those participating in the RISE learning community. This person may or may not be the director, but we do, again, recommend that an administrator or supervisor be involved. You'll also need the contact information for the agency coordinator, also known as the point person, for the RISE learning community. And this person will be a member of the CIT and will act as the liaison in coordinating participation. And lastly, the contact information for the remaining CIT members, who ideally will be at least 2 or more. So again, we do hope that you participate in this very important learning community.
Okay. So with that said, we're going to stop. We realize we did have some additional questions, but we just want to open it up to general questions that people may have with regards to the learning community. So let's take some questions, and we'll review them as we go. We do want to, though, say as those questions are coming in, we want to be clear that we consider this learning community a dynamic process. We will learn as much from you as we hope that you will learn from us. It is a dynamic process, and we'll be taking feedback on, how to make it better and useful to you all. And also, like I said, I'm skipping these chat questions because this has to do with just specific questions around things you can do. But at this point, please just text in any questions. Also, feel free to text in or chat in if you are ready to go, or if you still have some questions remaining that you would like to address back channel.
And we really want to know how this sounds to everyone. Does it sound like something you might want to do? Does it sound like you need to think about it? Any questions or concerns that you have, we'd love to hear. Oh, we have a question. What are the pros and cons of joining as an individual or as a group with the CIT?
Well, I'm not sure if that's a choice between individual or group. We want to be clear that we think joining as a group is ideal, because the more people working on it, we're talking about trying to sort of implement organizational change, and having more people within the organization working on it, more champions, increases the likelihood. But again, if you're an individual and you want to participate in this and it is difficult or burdensome to try to put together a CIT team, we want to also be able to provide the training for folks, at the very least, to increase your knowledge and awareness, and maybe start the process of becoming a champion or an organizational change effort agent.
Great. We have Kia, who said this is very helpful to know the primary aims and purpose. Janice says this sounds exciting, looking forward to relaying this info to my administrators. And then we have Catherine, who asked, did I hear correctly that this is only for those in New York? And yes, this is for those in New York State, Catherine. So if you are a social service provider in New York State, you are welcome to join. I'm also listing here our contact information, so if anyone has any questions, you can contact anyone on there. Feel free to contact me directly if you want to set up time for a call. If I see Janice is going to be talking to her administrators, if as a result of that discussion with your administrators or talking to other folks, of course you can refer them to this informational webinar for more information. But if you just want to call myself or Kara directly, we can try to set up discussions or give you more information with whomever you want to chat with. We're more than open to helping you start this in your agency. I see a question here, is it limited to certain agency types, OMH or OASAS? No. So one of the things that we want to be clear about with trauma-informed organizations is that, as we mentioned at the beginning, it's really important to understand that the principles of trauma-informed care really apply to a variety of service settings, behavioral health settings, mental health and behavioral health settings, substance abuse settings, residential care, social service programs, homeless programs and shelters. So we believe at juvenile justice, early childhood, I'm sorry, I keep going through all of them, but we believe that trauma-informed care, and when you look at the efforts that are going on across the country, I also want to be clear that you're joining a movement here. When you look across the country, there are efforts going on across the country in states, in counties, and cities across the country implementing trauma-informed care in all kinds of service settings. I don't see any others, and we are at time. So we want to thank you all for joining us today, and we hope and look forward to working with all of you. There's some last words in there about your next steps. Kara? Yes, so please fill out our application to participate with us. Or as Jim mentioned, please feel free to reach out to us. We'd love to have a conversation with you if you have any questions or concerns that we can specifically address. We'd be happy to do that. Okay, thank you so much to everyone who joined today, and we look forward to working with you. Have a great day, everyone.
Bye-bye.